We've been talking about the benefits of probiotics now for years, and a study just came out showing that probiotics can prevent heart attacks and make them less severe.
So what we're talking about is the microflora of the gut and how it relates to disease. And in this particular case, the microflora predicts the risk of MI and the severity of a heart attack and the recovery in rats. And I'm sure that we'll do this in the study in human beings as well, because it's
harmless.
It's harmless. It's not going to cause any problems. So when we're looking at how this works, we're looking at probiotics and knowing that what they do is they tend to restore a more normal ecosystem in the gut. They put those microbes that normally should be there back there so that they can crowd out those microbes that shouldn't be there. And the way they did this particular study on rats is they went ahead and they put them into 3 different groups. One they gave a standard diet to, just a standard American diet for rats. The other they put some vancomycin, which is an antibiotic, into the water of what the rats drank. And the third one, they gave them a probiotic, which are the friendly microbes. And what they found is that the standard diet, of course, didn't do anything to change the risk or severity of heart attacks. But the vancomycin in the water that they drank did make a difference, and the probiotics did. And so the question is how do you put this together? How does it make sense?
It has something to do with leptin.
Well, it did, but it actually, there's another way to look at it. The vancomycin kills bacteria that are in the intestinal tract. And it probably kills those bacteria that shouldn't be there, that maybe are causing a worsening of the symptoms of the heart attack and its severity. And, of course, if we put probiotics in, you put in the good bacteria, which dilute out the bad bacteria that are there that may be doing this.
You know, this makes me wonder if this would be a good idea for people that have heart valve problems, and when they go to the dentist, they frequently prescribe antibiotics. I wonder if they prescribe probiotics, if it would work.
Well, I think probiotics are always a good idea if you're using an antibiotic.
Yeah, along with it, but I meant instead of.
Well, I don't know. That would be a study that would have to be done. I don't think we know if the mechanism is the same, and that's the problem. One of the things that was correlated in this study, Vicki, is that when they used vancomycin in the water or they used probiotics, is that the levels of leptin, as you were pointing out, dropped. And it seems to be correlated, the severity of the heart attack and its lethality, its ability to kill you, is related to the level of leptin. The lower the leptin, the more protection you have. So that was an interesting finding.
And another thing that affects your leptin is if you get enough sleep or not, because that affects your appetite.
Oh, it definitely does. So I think what happens is when you don't sleep well, the body develops something called leptin resistance. And so you wind up with needing more leptin than normal to be able to suppress your appetite, because when fat cells make leptin, what that leptin does is it makes you feel full. So it would have a lot to do with how much you weigh.
So it sounds like getting enough sleep is good for your heart too.
All the lifestyle things are good for your heart, but that's a really good point to make. So when we're looking at probiotics and the prevention of heart attacks, it's innocuous, it's not going to hurt anybody. We should probably be taking them anyway because our gut has more metabolic activity than any organ system in the body. And when we have something that has that much activity, if we can modify the kinds of microbes that live there by living a healthy lifestyle, eating the right foods, making sure that when we do something to that complex ecosystem with an antibiotic or a drug of some kind, that we can go back to using probiotics to fix it.
I'd like to just sort of point out right here too that that's actually one of the functions of our appendix.
Right.
Our appendix actually provides us with probiotics.
Well,
we've only known that for a few years.
Well, it's a blind sac, and so whenever we have an infection, that blind sac, you can't push anything into it because it's already full of liquid, and so the infection passes over it, and then it continues to produce probiotic, which seeds the gut with the right microbes and with a biofilm that's protective. So we're looking at probiotics again to prevent heart attacks. Take it seriously. It's innocuous. It's something that's easy to do. It may just make a heart attack not happen in the case of your situation, or if you're going to have one, make it much less severe.